My name is Vakkai Dominic Esther. I'm presenting a paper on perception of healthcare workers on malaria and pregnancy. Malaria and pregnancy is the commonest and an endemic disease and the most vulnerable group of persons that are affected by this are the pregnant women. The federal government of Nigeria adopted prevention of malaria in pregnancy intervention as a component of a focused antenatal care to directly reduce the burden of malaria in our country, Nigeria. So, from the research conducted, it was observed that the healthcare workers believe that testing a client, which has become the priority for management of malaria now, is still believe that clients should be tested for malaria, but most of them still believe that negative results should also be treated, even though the test is negative. They also prefer to prescribe ACT for pregnant women, even though the national guidelines have stated that quinine is the first drug of choice for pregnant women in the first trimester. So the research is able to establish that a lot of resources are put in place to build the capacity of these healthcare workers, both by the government, the NGOs, the local governments, the partners around. So it just shows that the government as well as stockholders have to help to maintain the momentum which had already begun by all this group of people. So what? Considering that healthcare workers are the first contact to these women during pregnancy, their knowledge in managing the malaria infection in pregnant women is very, very important in order to prevent and then to do a proper diagnosis as well for those who are positive to malaria. This study exposed the underdiagnosis as well as mistreatment of malaria in pregnancy and the need for training and retraining of healthcare workers, as well as establishing the malaria diagnosis quality assurance program to ensure the accuracy of malaria microscopy RDT results at all levels. Now, the study was able to establish that yes, the healthcare workers believe in the RDT, but not as much as they believe in the microscopy. Some of them still believe that RDT is not potent, RDT is not accurate. So sometimes even if the test and the person is negative, they still go ahead to treat the clients. So that's what that is talking about. Now, background. Malaria during pregnancy is a major cause of maternal mortality worldwide and leads to poor pregnancy outcome. Pregnant women are more prone to complication of malaria infection than non-pregnant women. So prevention involves the use of drugs for those who are infected, and then the use of L-line for those who are pregnant, whether infected or not, to prevent further infection for those who are infected, and then for those who are not infected to prevent the infection, or using the intermittent preventing therapy. Now, it has shown that 8 million women are pregnant every year in Nigeria, and about 545 of them has women out of every 100,000 die as a result of pregnancy-related complication. So malaria has posed a serious public health challenge in Nigeria. It is with this consideration that Nigerian government in the past few years has renewed efforts towards controlling malaria. Several interventions have been introduced, amongst which were the introduction of the ACT, that's the artemisinin-based combination therapy, and massive distribution of long-lasting insecticidal nets, as well as the distribution of IPT for free in most of our health facilities. Now, the LLIN campaigns have been happening, routine distributions have been happening in various health sector at different community, at different, and that is reasonably free for all pregnant women. Method. A cross-sectional descriptive study is conducted in Kano State, which is part of the northwestern Nigeria. Random sampling was used to carry out the picking or selection across 10 local governments, and 15 health facilities in each local government were selected. 2 participants from each of these facilities took part in the research work, and a total of 300 of them were involved in the research. A well-designed self-administered questionnaire was passed to selected participants, who are all community extension workers, as well as health workers who attend to pregnant women at ANC. Their consent was obtained before they are given the questionnaire by the research assistant and the researcher. The questionnaire explored respondents' knowledge on diagnosis of malaria in pregnancy, its treatment, as well as current preventive measures, practiced and approved by national guideline. The questionnaire was pre-tested and validated before the study was conducted. Now, the states were also aware of this research. Consent was taken from them, the local government as well, because we went to the grassroots to get this data, since considering that most of our pregnant women are staying in our area, and then where we can get more. So they were involved too. Result. As I said earlier, the 300 respondents aged 20 to 60 years of age were more than half, that's about 52%, were male. 47.3% of them were female. In most of the participants, 33.9 of the age group 30 to 39, which are the youth, while the age 40 to 49 were 29%, and that of 20 to 29 age group were 24% respectively. The least percentage, which was 1.7%, were those who are of the group 60 years and above. Now, in the diagnosis of malaria during pregnancy, now we ask them questions if they would like to diagnose malaria using RDT before they are tested. About 50% of the respondents agree that patients who reacted positive to malaria RDT has malaria. 42% strongly agree that such clients has malaria, with 3.3% being neutral about the test, while 2.7% of them strongly disagree that if a woman tests positive to MRDT, then she has malaria. 0.7% disagree completely about the test. On the perception that patients who react negatively to MRDT, 40.7% of them agree, 19% of them strongly agree, while 13.7% disagree. 14% still remain neutral to the questions. Now, 39% of respondents agree that MRDT usually means malaria. That means some may have malaria, and then it may not show in the test that the person is testing positive to malaria. 5.7% strongly agree, while 35.3% and 7.3% disagree and strongly disagree, respectively. Results continue. Now, the table, the health perception of healthcare, out of 20 respondents agree that anti-malaria drugs are justified for malaria cases. That is, if somebody is tested for malaria and it is positive, anti-malaria should be given to the person. 0.9 respondents strongly agree on justification for administering malaria drugs. 5 respondents disagrees if they are tested, they mustn't be given the anti-malaria, irrespective whether they are positive or negative. About 129 respondents disagree that febrile patients should be treated with ACT without RDT. That means even though the person is febrile and comes to the facility, he or she should be treated with ACT, irrespective, even if he's tested or not. 60% of them disagree strongly on treatment of febrile patients with ACT without RDT. That means such a person should be tested first before he or she is treated. Now, in the pregnant woman, she is treated. While 62% agree on treatment irrespective of RDT or no RDT. On another vein, 43% disagree that they will take anti-malaria drugs if they feel feverish without doing an MRDT. That's on the part of the healthcare worker now, because we are trying to understand if they can like practicalize what they are taught or the guideline on themselves. So. And 20% strongly disagree that if they are febrile, they may not carry out the test. Now, 20% agree to taking anti-malaria medication if they feel feverish, even without testing for themselves. In conclusion, the study was able to expose underdiagnosis of malaria or mistreatment of malaria in pregnancy. That means there are lots of pregnant women that comes into this facility that are feverish and are not tested either by RDT or by microscopy. And then further treatments given to the positive clients are misused, not according to the national guideline. So it was also discovered during the study that healthcare workers with reasonable years of experience need more training and retraining in order to update their knowledge on the current treatment of malaria, because some of them keep practicing what they knew before on malaria. And then we're in an era where research are done often and then new things come up and then treatments are changed. So this group of healthcare workers need retraining and retraining or on-the-job training to help them enhance their knowledge. It is very important that the government and the stakeholders, as well as partners, takes responsibility to educate these healthcare workers, irrespective of their cadre, whether in the rural area or in the urban area. Future steps. Now, we should be able to advocate for retraining to these healthcare workers, then approach partners to conduct more on-site mentoring for healthcare workers, because it is known that when you go on the site and meet them working, you can now correct what they're doing and put them online. They tend to remember better. Research like the potency of RDT in dictating malaria and accuracy of the result, because most of them still believe that RDT is not potent. So more research to prove that or improve the RDT will help to improve the diagnosis of malaria. Dictating the level of parasitemia in women who are infected by malaria. It's also a future research that should be conducted to help out in this. So basically that is from the findings. Thank you very much for listening.